What are stem cells? Stem cells are incredibly special because they can become many different types of cells. Think of them as your body's built-in repair kit, able to transform and regenerate damaged tissues. Adult stem cells. The hidden heroes. Adult stem cells exist all over your body, in your brain, bones, blood vessels, muscles, skin, even your teeth. Usually they remain dormant, but when needed, they spring into action, dividing and specializing to heal damage or replace old cells. Harvesting stem cells. One incredible use for adult stem cells is repairing the heart after a heart attack. Doctors harvest these stem cells from the patient's own bone marrow, where they're highly concentrated. Growing and culturing stem cells. In a specialized lab, scientists filter the sample, identify the stem cells, and encourage them to multiply and specialize into the exact cells needed to repair damaged heart muscle. Stem cells in action, repairing the heart. The specialized cells are carefully injected into the damaged heart tissue. Once there, these stem cells attach to the damaged fibers and begin growing into healthy new tissue. Repair and regeneration. After several weeks, the heart muscle is revitalized. Stem cell therapy can even reduce scar tissue, improving the heart's function and strength. Where do adult stem cells originate? Researchers still wonder where adult stem cells originally come from. One theory is that some embryonic stem cells remain hidden in our tissues after our initial development. Embryonic versus adult stem cells. Embryonic stem cells can become any type of cell. However, their use is controversial because it involves creating embryos specifically to harvest cells. Adult stem cells are less controversial, but were once thought to be limited. Today, new techniques are expanding what adult stem cells can become. Tissue engineering, growing new body parts. Scientists have discovered that how stem cells grow depends heavily on their physical support structure, called a scaffold. This scaffold helps guide cells into the exact shape and structure needed to repair specific organs. Case study: repairing the eye's cornea. To fix a damaged cornea, doctors harvest healthy stem cells from a patient's unaffected eye. These cells are grown in the lab on a dome-shaped scaffold, creating a healthy layer of cells ready for transplant. Successful transplant. The damaged corneal tissue is replaced with this scaffold. After a few weeks, the scaffold dissolves, leaving behind a repaired, healthy cornea, often fully restoring the patient's sight. The future of stem cell research. Stem cell research is advancing rapidly, improving our understanding of human development and healing. The most exciting potential includes growing replacement organs and even reconnecting damaged spinal cords, potentially allowing paralyzed people to walk again. Challenges and ethical considerations. Despite their incredible potential, stem cells raise ethical questions, especially around embryonic research. Balancing scientific advancement with moral considerations continues to be an important discussion. Connecting the dots, from cells to cures. Stem cells illustrate the amazing power of your body to heal and rebuild. They represent not only hope, but a future of medicine personalized to each patient's own cells. Every journey toward healing starts small. Here's today's motivational quote: "Healing takes courage, and we all have courage, even if we have to dig a little to find it." If you enjoyed this episode, please like, subscribe, and stay curious. There's so much more to explore.